Women's health and especially abortion-related policy also were big topics under the Capitol dome. Joining us with more on that is Eleanor Klibanoff, women's health reporter at the Texas Tribune. Eleanor, thanks so much for joining us.
Thanks for having me.
So, Eleanor, let's start with the so-called Life of the Mother bill, which passed both houses. The bill's intent is to clarify when abortions are permitted to save the life of the mother. It follows Pulitzer Prize-winning reporting from national media outlet ProPublica. Their investigative series revealed that at least 3 Texas women have died due to changes in maternal care resulting from our state's abortion ban. From your own reporting on this, do physicians, OBGYNs here in Texas, believe this bill goes far enough?
Certainly, there are some OBGYNs who are celebrating this, who feel like, particularly those who are having to make these sort of decisions where they could face up to life in prison or the loss of their medical license, hundreds of thousands of dollars of fines, if they were to sort of make the wrong call in these extremely time-sensitive cases. They feel like this is getting the endorsement of state politicians to say, we are not trying to criminalize doctors who are using their good faith judgment to, perform life-saving abortions. But there are a lot of doctors who feel like this actually doesn't really clarify when they can intervene, and it doesn't give them the certainty that they need. They would really like to see, the state lawmakers, the Texas government taken out entirely from the doctor-patient relationship, and they won't really be satisfied until that happens.
Do you expect the governor to sign this bill?
Certainly. This bill has widespread support from Republicans, which is hard to imagine, even just a couple years ago to think about, Republicans rallying around a bill that, while it doesn't expand abortion access, it does certainly sort of seed that there are some problems with the near total ban. And it is resulting in really negative outcomes that, frankly, they don't want, hung around their necks politically.
Mm. And a bill to further restrict abortion medications, it failed, disappointing anti-abortion care advocates. Why do you think it failed?
So this is an issue that, for anti-abortion groups and certainly many conservative Republicans is a huge deal, right? The idea that people are circumventing the abortion bans that they worked so hard to put in place by obtaining abortion pills from any number of sources, right? People are getting these online. You can get them shipped to your house in 24 hours. You can get them prescribed by a doctor in another state. This is extremely frustrating to them. And they would like to go, they think there's no limit to how far you should be able to go to crack down on that. Most Republicans, though, kind of feel like we did what we needed to do on abortion. It's banned. We're kind of still getting a lot of flack for it. Let's just leave this issue alone. And that's certainly what we saw play out in that bill.
Also, meanwhile, a bill banning cities from providing funding to women to travel out of state for abortion care was passed. Is it safe to assume the governor will sign this bill as well?
Certainly. This is a bill that has pretty widespread support among Republicans. It's really targeted at cities like Austin and San Antonio that have tried to use state or taxpayer dollars to support abortion funds and groups that help people travel out of state to get abortions. This would put an end to that. It's a pretty narrow restriction, certainly not anything like we've seen in previous sessions in terms of sweeping crackdowns on abortion.
Now, what about funding healthcare services like expanding Medicaid or otherwise? Were any measures passed to provide more or maybe better care to women in a state with the highest rate of people who lack health insurance?
Certainly, we did not see any sweeping changes on this front, right? Texas remains unwilling to expand Medicaid. We did see some additional funding, almost, as always, going towards groups that support what used to be called the Alternatives to Abortion program. Now it's called Thriving Texas Families. These support families who, or these dollars support families who choose to not terminate and carry a pregnancy to term. Again, it's a pretty small program. It's a lot of dollars, but it serves a pretty narrow constituency. We saw some changes, some additional funding for family planning programs, things like that, but nothing, really widespread or no major change on that front.
Certainly a memorable session, to say the least, the 89th session of the Texas legislature. Eleanor, thank you so much for this update on women's health policy. I hope you and all of our other amazing panelists today can get a much-needed break and maybe even a drink after this session.
Thanks for having me.
Thanks so much for watching. Be sure to like and subscribe and leave us a comment below to let us know your thoughts on this video. And don't forget, you can watch full episodes of Austin Insight for free in the PBS app.